Welcome back to Spencer FYI, and in our series of behavioral health and in partnership with LINC, we're going to talk to a representative from Rosecrance Jackson Centers. So tell me a little bit about Rosecrance Jackson Centers and kind of what you do there.
Okay. Rosecrance Jackson is primary substance use treatment, but we also have some co-occurring mental health treatment that we do within our agency. My name is Susan Garro. I'm a clinical supervisor for the satellite offices, so I supervise Spencer, Sheldon, Esterville, Cherokee, and Lamar's offices. We also have a whole range of residential services and outpatient services located in Sioux City as well.
All right, so kind of a wide area that you cover then.
Yes.
So you've actually probably have quite a bit of flood coverage right now too with
Very
this
much
part
so.
of the country.
Very much so.
All right, well, let's talk a little bit about some signs that maybe a person can look for in somebody that is maybe having some trauma regarding the flood.
Sure. I think that it's important to understand that people are going to respond to some kind of natural disaster differently. In our area of expertise, what we worry about is people that are turning to like alcohol or substances to cope more effectively with a disaster. So for a person that is in recovery, we would definitely have some specific risk factors that we would look for, like if they're having a lot of difficulty with sleeping, if they're maybe sleeping too much or sleeping too little, if they're reluctant to leave their home or struggling with isolation. It could be depression or sadness, anxious thoughts. A lot of these things are normal things as well, but an increase or something to exhibit like loss of control would be a large concern.
All right. So what can an individual or a group help manage that individual or their behaviors?
Well, I think it's really important to understand for a person in recovery, oftentimes they're engaged in the recovery community. So definitely those kinds of supports are very important for people that are in recovery. So for individuals that are experiencing difficulty with substance use, they really should seek professional help. Oftentimes people that are struggling with substance use will have co-occurring mental health as well, and an agency will always help with a referral to help get them the additional support that they might need. I think it's important to also recognize that the state of Iowa Health and Human Services has a wonderful free 24/7 resource that can definitely be very helpful. yourlifeiowa.org is a wonderful resource. You can call, you can text, you can chat with an individual, and they will also help you connect with resources in the area. I would venture to guess that they probably have been very engaged in helping individuals at this point in time. And just some basic strategies like regularly exercising, practice like meditation, things to slow down the process a little and find more healthy coping skills is really an important thing to do. And we always advocate as well in the recovery community to perform acts of service. So things that you can do to help others helps the individual kind of get out of their own situation, their own thinking about their own issues and help others can be very, very helpful. As long as they're practicing self-care practices for themselves can be very helpful to them as well.
Good advice there, yeah. So what can people do to help their friends that may be struggling? I guess maybe we already kind of answered that one, but.
Well, I think having like conversations with people about the emotions that they're experiencing, even if it's difficult, as well that promoting physical and emotional well-being, healthy eating, getting enough rest, trying to establish some regular routines as much as possible is really important to do as well. And then maintaining a regular family, sense of community, those kinds of things are very important as well.
Even if you may not be in your regular community, but it's important to try to figure out how to get that to happen, right?
Yes, very much so.
Alrighty. We've talked a little bit about survivor's guilt with other providers, whatever. But do you see something like that maybe is a little stronger with somebody who's in recovery, or not so much?
I think it can be pretty normal for almost anyone that's experienced a natural disaster. I think it's really to be honest and to be compassionate, but not take on that guilt yourself. it just happens to be the circumstance that it is. We have an expression that we use in recovery a lot, it is what it is. So letting other people know that they're very much cared for, trying to be helpful to them, listening to their feelings, being calm and very factual about things as well. Yeah, and as always, seeking professional help if it's needed.
All right. What are like some normal feelings that maybe people would have after this natural disaster, and short term, long term, kind of what do you kind of think folks may feel?
Well, I think people are going to feel anxious about their safety, as well as that of their family and friends. Profound sadness, grief, and anger, I think, are all very normal as well. So in the short term, I think it's just really acknowledging your feelings and then working towards like small wins, breaking it down into sizable measures that you can do, steps that you can take to assist other people as well as assisting yourself. So adequate rest, a routine, those kinds of things. More in the long term, I'd say it's really important to focus on the positives. Strengths and ability, witnessing acts of compassion in the community. I'm seeing signs of Spencer Strong everywhere, and I know that people that are out there have seen. We have staff that have volunteered hours themselves. They have witnessed and experienced a lot of people getting great help. And those kinds of examples, I think, are the things that you have to really kind of focus on. And then accepting help, like learning not only, the most important coping skill is asking for help, but also being willing to accept the help in the community. I think that's helpful to not only the receiver, but also the giver.
Mm-hmm. All right. So how can your agency help out, that you've asked for help now, so what's kind of maybe the next steps?
So we provide substance use treatment as our primary at the outpatient level of care. That's kind of the lowest level of care that we offer. We do evaluations for people that come in that are needing. We just give us a call. We can schedule an evaluation to help to determine the most appropriate level of care. In Sioux City, we provide residential care for men, for women, women with children, and adolescents as well. We have halfway houses for men and for women. And then we have a whole range of outpatient services as well. So downtown adult outpatient provides outpatient services. There are mental health professionals located in that office. We in the satellites can also make referrals to those mental health professionals as well. And then we work with a lot of local agencies as well, definitely. In the satellites, we're a little bit more of a one-stop shop, but we can make all those referrals that are necessary. Again, it's determining what's the most appropriate level of care for the individual.
Okay. That can come from maybe an outside person as well as yourself, right?
Definitely. So we definitely want to interview the individual themselves. That's how we get the assessment completed. But we definitely ask for also collateral information from other people that can give tips or what they're seeing or what they are experiencing with the individual.
So is you just do some self-care, make sure you're feeling good to yourself and don't medicate yourself, correct?
You should definitely limit alcohol use in a time of crisis, most definitely. And if there's other extenuating circumstances, it's important to take prescriptions as prescribed, as directed by your doctor, and not to take them excessively. But also know that there is help available if you need it. You simply have to ask for it.
Right. And is there a number or something that folks can call?
Yeah.
Or where can they go?
On a local basis, it's 712-584-2030. And that will get you in touch with our office coordinator, who will happily schedule you with an evaluation. That can happen via telehealth, or it can happen in person.
All right, awesome. Anything else you want to add that I haven't asked, or that you want to make sure that you stress?
I just think that Spencer has done a wonderful job of coming together, and the acts of volunteerism have been really inspirational. So I think focusing on the positive is a really good thing to do, and being part of the community, being a part of, rather than separating yourself from those things.
All right. Awesome. Well, thanks so much for taking some time to talk to us, and hopefully you've given the folks out here some things to think about and an outlet that if they need some assistance, so they can get it.
Sure. Thank you.
You're welcome. Thank you.